Hello and welcome to my channel. Today, we delve into a condition that impacts millions globally, attention deficit/hyperactivity disorder, or ADHD. It's often misunderstood as solely a childhood issue, but as we'll explore, it's a chronic neurodevelopmental disorder with significant implications across the entire lifespan. ADHD is fundamentally understood as a neurobiological disorder, or a chronic neurodevelopmental disorder. It's characterized by a persistent pattern of inattention, hyperactivity, and/or impulsivity. These symptoms are not just present. They are typically at developmentally inappropriate levels, meaning they are more severe and persistent than what would be expected for an individual's age. While some specific symptoms, such as overt impulsivity and hyperactivity, may appear to fade with increasing age, the core difficulties with inattention and poor concentration very often persist. It's crucial to recognize that ADHD is not simply a childhood disorder that individuals automatically outgrow. Awareness has increased in recent years that these same problems often persist in adulthood. Significant difficulties continue to affect 50% or more of those diagnosed with ADHD in childhood. Prevalence estimates can vary, but it's widely reported to affect approximately 10% of children and adolescents. This means that in a typical classroom, a significant number of students may be experiencing ADHD symptoms. In adults, the prevalence is estimated at about 4%. This highlights that it's a condition that continues to impact individuals well beyond their formative years. Specifically within the college student population, ADHD symptoms are estimated to affect 2% to 4%, and approximately 2% to 8% of college students self-report clinically significant symptoms associated with ADHD. This group faces unique academic and social challenges. The persistence of ADHD into adulthood means that adults may not always meet the full diagnostic criteria for ADHD, even if they continue to experience disabling symptoms that significantly impact their daily lives. The manifestation and impact of ADHD symptoms evolve throughout a person's life. In childhood, the hyperactivity impulsivity component is often more pronounced and observable than inattention. This can manifest as restlessness, difficulty staying seated, or interrupting others. ADHD significantly affects children's ability to function effectively in school and other important environments. They frequently encounter difficulties in social relations and academic settings. These early difficulties can have profound long-term consequences. They imply problems in adolescence and lead to undesirable outcomes in adulthood to a much greater extent than for children without ADHD. This underscores the importance of early identification and intervention. As individuals with ADHD transition into and navigate adulthood, they face a range of psychosocial challenges. Individuals often experience difficulties fitting in and functioning in social relations, which are most apparent in workplaces and within family dynamics. This can lead to strained relationships and isolation. Problems with low self-esteem and a limited circle of friends have been consistently reported in children with ADHD, and unfortunately, these issues often persist into young adulthood. Individuals with ADHD may also report lower self-rated social and emotional abilities and overall lower self-esteem. While these problems are recognized, there is limited calculable data on the exact cost of these psychosocial difficulties. The impact of ADHD extends significantly to educational and professional trajectories. Symptoms frequently lead to problems concerning schooling in childhood and adolescence, including difficulties in acquiring knowledge, following instructions, and adapting to school rules and routines. Studies consistently show that individuals with ADHD have, on average, a shorter education, often about 2 years less on average, fewer higher degrees, poor grades, and a higher incidence of failed courses. As adults, they often find themselves in employment of lower status compared to their control groups. College students with ADHD tend to have significantly lower grade point averages, GPAs, and report a greater number of academic problems. They are also more likely to be on academic probation and less likely to attend and graduate from college than their peers without ADHD. While not all studies show academic problems, the general trend indicates significant challenges. Substance abuse is a particularly concerning comorbidity in individuals with ADHD. Individuals with ADHD appear to be overrepresented among those who misuse substances, including narcotics and alcohol. A striking statistic reveals that up to 50% of individuals with persistent ADHD symptoms suffer from substance abuse. This highlights a critical area for intervention and support. Persons with ADHD and/or conduct disorder, CD, may experience earlier drug debuts, engage in abuse of longer duration, and are more likely to progress to heavier drug abuse. The overlapping symptoms of ADHD and CD particularly increase these risks, especially concerning dependency on marijuana and heavier drugs. Interestingly, boredom proneness and sleep disturbances have also been linked to higher hyperactivity scores in college students, suggesting that a desire for external stimulation might be a characteristic driving some substance use. Comorbidity with other mental health disorders is exceptionally common in individuals with ADHD. Follow-up studies have consistently shown that childhood ADHD is associated with a significantly increased risk of developing antisocial personality disorder, ASPD, in adulthood, particularly when there is comorbid conduct disorder in childhood and adolescence. Adults with ADHD also have a significantly increased risk of developing other comorbidities such as anxiety, depression, and generalized substance abuse. Some studies have found that a substantial proportion, 59% of ADHD subjects, had some form of psychiatric disturbance compared to 36% of controls. The comorbidity with disorders like depression and anxiety is widely acknowledged. A systematic chart review of college students with ADHD seeking services revealed that while 45% had no evidence of comorbidity, the remaining had various diagnoses, including depressive disorders, 26%, anxiety disorders, 5%, and drug and alcohol dependency, 26%. Some studies also indicate greater psychological distress and problems in college students with ADHD compared to controls. The symptoms of ADHD often imply less controlled behavior, leading to increased engagement in risky activities. Research on adults with ADHD has primarily focused on behavior and associated risks in traffic situations. Individuals with ADHD have been found to have significantly higher risks than controls for accidents, driving under the influence of alcohol and drugs, driving without a license, and speeding. One study found that license loss was 3 times more common in ADHD subjects compared to controls, and they experienced a greater number of traffic accidents. Beyond driving, college students who self-report high ADHD symptoms also reported greater psychological distress and anger, and tended to express this anger in socially unacceptable ways, including in driving-related situations. Furthermore, college students with high ADHD symptoms were more likely to engage in physical and sexual aggression in relationships. ADHD also has a concerning connection to criminality and, potentially, a reduction in life expectancy. Individuals with ADHD and related disorders are notably overrepresented in crime statistics and among prison inmates. This is likely a result of the combination of risk behavior, psychosocial problems, and substance abuse. Specifically, hyperactive boys with conduct disorder, CD, have shown significantly higher arrest rates in both adolescence and young adulthood compared to controls. Individuals with ADHD have more often been arrested, convicted, and incarcerated compared to controls. While hard data on life years lost directly attributable to ADHD is lacking, studies suggest that poor impulse control itself is the single most important factor in the prediction of early death. The presence of substance abuse and psychiatric problems further strengthens the assumption that ADHD and related disorders may be associated with reduced life years. Now, let's explore potential approaches to improve attention in individuals with ADHD. Mindfulness-based interventions, yoga, and meditation have garnered significant interest. Mindfulness is defined as a receptive attention to present experience and involves the self-regulation of attention. Mindfulness-based interventions, MBI, have received clinical interest and empirical support for individuals with ADHD, particularly for improving attention. The practice involves focused attention and can lead to beneficial changes in conflict attention, which is crucial for self-regulation and often lower in individuals with ADHD. This suggests that mindfulness training could be a viable way to boost attention. Various types of MBI, including mindfulness-based cognitive therapy, MBCT, mindful awareness practices, MAP, and mindfulness-based stress reduction, MBSR, all incorporate the practice of self-regulation of attention. Studies, particularly on adults with ADHD, have demonstrated significant improvement in attention or a significant reduction in inattention symptoms after MBI. Preliminary evidence also suggests benefits for adolescents, and one study even noted a significant reduction in inattention for children based on parent and teacher reports. A meta-analysis focusing on youth with ADHD showed that yoga, mindfulness-based interventions, and/or meditation had a statistically significant effect on outcomes, including inattention, as reported by parents and teachers. Mindfulness also appears to address deficits in executive function and impulse control by fostering the capacity to observe impulses without immediately acting upon them. However, it's important to acknowledge that conclusions about the effectiveness of MBI, yoga, and meditation, particularly for youth, are currently limited by significant methodological limitations and a high risk of bias in the existing studies. More rigorous and well-designed research is essential to solidify these findings. For college students, academic accommodations are often employed to help manage ADHD symptoms in an educational setting. Typical academic accommodations used at universities include access to books on tape, note-taking services, distraction-free rooms for testing, extra time for examinations, alternative forums for examinations, and adaptive equipment. While these accommodations intuitively seem helpful for students to focus better during academic tasks like tests, most of them unfortunately lack rigorous empirical studies to investigate their actual effectiveness at enhancing the performance of students with ADHD. More research is needed to establish their efficacy. Beyond direct interventions, difficulties with attention, particularly in academic settings for college students, may be related to impaired organizational skills, study skill deficits, and executive function deficits. Higher levels of internal restlessness and intrusive thoughts are also hypothesized to be associated with compromised attention skills. Addressing these underlying factors, such as improving organizational strategies or developing better study habits, might indirectly contribute to improved attention. In summary, ADHD is a chronic neurodevelopmental disorder with far-reaching impacts on an individual's life, from childhood through adulthood. When it comes to improving attention, current approaches include mindfulness-based interventions, yoga, meditation, and pharmacological treatments, with academic accommodations also being utilized in college settings. Ultimately, managing ADHD requires a comprehensive and individualized approach that considers the evolving needs of the individual across their lifespan. Thank you for watching. Please don't forget to subscribe for more content like this.